Welcome to another video. If you're a runner or like working with runners, today's video is for you. Had a great time talking with Dr. Kat Campbell on her Running with Kat podcast, and we talked about blood flow restriction training and how it's my secret weapon when working with runners. So again, I hope you enjoy the video, and if you stick around to the end, there'll be a special offer for you. So enjoy.
If you ever followed an athlete on Instagram coming back from some sort of injury, there's a good chance you might have seen them using blood flow restriction cuffs. Blood flow restriction training is starting to become utilized more in the rehab and sports performance world and can help runners in so many ways. But what are the benefits? How do you correctly use BFR? And who should use it? In today's episode, I have Dr. Scott Greenberg here to talk about blood flow restriction training for runners. Hi, Scott. Thanks so much for joining us today. I just wanted to start off by having you introduce who you are, what you do for work, and how you started running.
Great. Thanks for having me, Kat. This will be a lot of fun. So what do I do? That's a great question. I wear many hats in my current role. So my title is Manager of Operations for the University of Florida Health Department of Outpatient Rehabilitation. And with that, one of my roles is I treat the Florida Gator athletes. I direct our UF Health Sports and Orthopedic Physical Therapy residency programs. I do a lot of other things, project management and such throughout the day, but I've always been involved with running. Running medicine has been a passion of mine pretty much since I started my career about 23 years ago, something along those lines. So it's been a long time. Started with my love of the foot and ankle, and it kind of morphed into how can I treat as many athletes as possible? And seems like every sport that we're involved with, maybe not swimming as much, but is involved with some sort of running. And I figured that would be a great niche for me to kind of get into. I never truly ran in high school competitively. And if truth be told, I actually hate running in the sense that when I was a high school wrestler, I used to have to run in wetsuits and in the sauna and jog. It was so my mind and running don't always kind of coexist together in a pleasant spot. So I was always involved in athletics, and again, running takes such a big part in so many sports that understanding biomechanics and how to deal with the runner has always been something that really interested me. And how to be as efficient as you possibly can with running is another thing, and obviously injury prevention and such. But my career has kind of led me to be involved with the American Academy of Sports Physical Therapy, where I was the running SIG chair, special interest group chair for several years. I also teach as part of the Run DNA curriculum. I teach components of what they kind of have out there. And to go along with that, I'm also USTFCCCA endurance running certified specialist. So, and USA Track and Field Level 1 certified specialist. So I do have some cool initials after my name. I don't know what they mean, but it seems to have the alphabet soup that people seem to like. So that's me in a nutshell.
The alphabet soup. I love that. That's so true, though, especially runners. They love all the certifications. And you do wear many hats for all the people out there listening. How I met Scott was I took the Run DNA course in New York City at Custom Performance, and we met there and we're chatting, and I said I had to have you on the podcast. So he mentioned blood flow restriction training. I thought that was the perfect topic. I had that already on my list of things that I wanted to do. But yeah, no. And I think it's interesting that you mentioned that you don't have like a great relationship with running, or you didn't when you're in high school, because a lot of people say that over and over and over again. Everyone that I have on here is saying that. So would you also say, though, that now you have a better relationship with running? Like, is it, or do you still have that kind of connotation since when you did wrestling that you still don't love it as much as like you probably would have if you didn't have to wear all that and do it more aggressively?
So my ongoing joke I always have when people ask me how do I run or what do I like to run, I say I only run when I'm chased. But that's not necessarily true. I think my ideal distance when I run, 5Ks are great. Get out there, kind of disconnect for a little bit. And again, I'm not like a lot of my athletes who can do a 5K in lickety split. I'm not one of those guys. I kind of just plod along, get my, 8-9 minute mile in there and I'm good to go. Not like my athletes that are doing, the 4 minute miles and stuff and finish that in pretty quick time. So I think a 5K for me is ideal. I have run as much as a 15K, but I tend not to do those that much. The 5Ks are great.
The 5Ks are nice in Florida. Anything more, it gets to be really, really hot. Anyways.
That's true. But in Gainesville, where I am, we're fairly flat, so we have that going for us at least. It's hot and flat.
That's true.
Hot and flat.
Yes. And then I also agree with what you're saying about most athletes, right, do have to run in some sort of capacity. So I do agree. It's one of those things that's very universal. Like we walk and we run. So anyone could really benefit from this type of conversation, whether you are someone who is running or is a sprinter, running 5Ks, running 10Ks, running half marathons, ultras, whatever. And blood flow restriction training is something that more people are talking about. I see more people using it. I think it's becoming a little bit more universal where PT clinics are using it too. Like it's almost a no-brainer that they should have it. So tell us, what is blood flow restriction training? Because some people might not even know what that is. We will probably refer to it as BFR for people who are like, what is that? It's blood flow restriction training. So yeah, tell us a little bit about what is it?
Okay, so in pretty much layman's terms, we're basically restricting the amount of blood that is in essence leaving the limb when we're doing some sort of exercise. So you're limiting the venous return and you're allowing a little bit to come in arterially. So usually it's about 80% in the lower limb, maybe a little bit more in the upper limb. And what I tell my patients is it's a way to trick the body into creating the same environment that you would otherwise get with heavy resistance training. So in order to get stronger, typically you have to use or stress your body at a one rep max of about 70-75%, meaning that whatever your one rep max is, in order to truly get a muscle response or a positive hypertrophy response, stronger response, you're going to have to tax that tissue at least 75% of that. So if your one rep max is 100 pounds, then you need to be working out with a resistance of about 70 to 75 pounds. The cool thing about blood flow restriction is that you don't necessarily need to put that same amount of load on the tissue in order to create that same response. So in rehab, for example, it's wonderful, especially if somebody's coming back from an injury or a surgery. You can load the tissue with 20 to 30% of that one rep max. So in this case, in that example, 20 pounds or 25 or 30 pounds, and create that environment that is much similar to that of the 70 to 75% that you're really taxing that tissue. So there's a lot of different chemical responses that occur via blood flow restriction that are, again, simulated to that or similar to that of when you are not actually restricting the blood flow. So if a runner's, I would say like your typical runner out there, I'm stereotyping a little, is listening and they're you're saying that you can basically use blood flow restriction training to stimulate that muscle as if it's under heavier loads. Why should they care? Like, what if, okay, cool. But some runners hate strength training, a good portion of them. So why should they care, and what should kind of, I guess, entice them to possibly use blood flow restriction training? That's a great question. So first of all, I'm going to just preface this by saying there's not a real good substitute for heavy load resistance training, right? If you can load with certain types of resistance at 70 to 75% of your one rep max, you're going to get a lot of benefits from doing that. And I think you should continue to stress your body in that way. However, there are times at which, a lesser load can be beneficial, especially in a running population where most runners run for exercise or train. They don't train to run, right? So getting a runner to do any type of strength training is hard because they feel it takes away from their running. One thing that blood flow restriction can do is it could allow the runner to get a lot of the benefits of strength training without creating the same type of recovery needs that a regular resistance loading session would kind of cause. So that's one benefit, is that they can get the same type of muscle response without taxing the body, which then will take away from their running and their enjoyment of getting out there and hitting the pavement.
I like that you mentioned that, because I wanted to mention, I know I had mentioned in the little quick blur before, is like sports performance. So would you say that blood flow restriction training in terms of runners could be useful to just use for sports performance? Like, let's say someone isn't injured and they're not necessarily going through rehab. Like, I mean, I think when I think blood flow restriction training, right, I think like I have a girl who just tore her ACL, using that for her. I have someone who was post-stress fracture, definitely using that for her. But what about that person who just, like you said, maybe just needs to get stronger but doesn't necessarily have an injury? Would you say that blood flow restriction training is good for them to use, or would you just say maybe just focus on the strength training? And I know it all depends. But
No, I really do think there's a place for the non-injured runner to incorporate blood flow restriction for the same reasons I was talking about before. It's a way to one problem that runners have is they don't recover enough, right? So that's one problem. This will allow them to recover because the soreness and those things that are typically associated with heavy resistance training are lessened by using blood flow restriction training, because you're not using the same type of load on the tissue. Okay, so that's number one. Number two, blood flow restriction can actually, oftentimes, if used certain ways, can act as a pump to help with the recovery as well, kind of flushing out some of the lactic acid buildup that's been in the tissue, etc. So it helps clear that muscle a little bit quicker, which I think is another benefit to it. Again, blood flow restriction is not going to take the place of heavy resistance training, but again, I think can be a very valued tool that runners and athletes in general should utilize, especially in season when they're training or when their loads are higher from non-strength training means, like if they're in competition, if their volume's high, whatever it may be. You don't want to just stop strength training, because strength training, we know, helps with performance. The stronger you are, the more aerobic capacity you have, the better performance you're gonna throw on the track or on the road, right? So if we can increase that with blood flow restriction training, which we know we can help aerobic capacity, we can help increase hypertrophy and muscle strength with blood flow restriction training. So I think it is a very valuable tool that runners can incorporate as part of their running to help aid in not only performance, but also in aiding with their recovery and allowing them to run longer and healthier.
So would you say that differentiating factor of like runners using blood flow restriction training in more training than rehab would be that they're in season? Like, would you say that every runner should use blood flow restriction training if they're in season and they have really high mileage and they just can't tolerate being fatigued for their other runs? Like, everyone should use it? Or is there a group of people where you'd say, no, I probably wouldn't use it with them, or probably wouldn't recommend that for them?
No, I think it's definitely great. Well, number one, what runner is not in season, right? They're always in season. They're always running, right?
Yeah,
So
true.
that's a caveat to that one. But I will say there is a time and a place in which it can be more beneficial. And I think it's not going to be like you're going to use blood flow restriction training every single strength session you do. I think it can be thrown in there and programmed so that you can, maybe after a long run, or a hard week's worth of workouts, you can actually incorporate a little bit more blood flow restriction to continue the stimulus but not stress the tissue as much. It's great for the older athlete, the older runner, and I'm going to even say the older person that wants to go to the gym. Because what does blood flow restriction training do? It allows you to strength train without putting the load on your tissue and your joints. And as we get older, not only does our body tend to lose the ability to gain strength, right? We all know that as we age, our strength diminishes. One way in which we can continue to keep that kind of flourishing is by stimulating it in a way that doesn't do other damage to some of our other tissues. So I'm not saying, again, that you shouldn't do strength training, but as we get older, we know that we can't put the same amount of weight on the bar that we used to, and blood flow restriction is a way in which we continue to stress our tissue in a safe manner and hopefully get similar gains and similar benefits.
Yeah, and that's a good point, because even with age, we know that as you age, it takes longer for us to recover. It just does. And that's something I talk about with people all the time, is like, it's a lot of times people get scared of aging. Like, they're like almost scared to run, period, as they age. But I think it's a matter of also knowing, like, it takes maybe what would have took maybe one day after a speed workout to recover, it might take two. And so again, to use that blood flow restriction training on days to promote that recovery goes back to what you were just saying as well. And so let's talk about programming, because I know you mentioned programming. Like, what would you recommend is the perfect amount of, let's say, like sets, reps? Like, how long should they have it on for? How many times per week should they be using it? Like, what does that look like for, let's say, a general runner who maybe is trying to use it for, let's put someone in like a rehab boat and then like a sports performance boat, and maybe it could be the same, but I just want to know what your experience is with using that.
Great. There's like a whole bunch of stuff to unpack in that question, right? So to be completely honest with you, in terms of the programming, the number of sets and reps, I think it's going to depend a lot on what exercises and what muscle groups you're trying to target. And in terms of how long that you should be totally occluded for, I tend to not go more than 15 to 20 minutes of complete total occlusion time. And if you're able to maybe occlude the tissue for a couple of minutes, then allow the blood flow to return, then do another exercise, give them some rest, do another exercise, occlude them again. I think you're going to be able to get away with a lot more time, because the total occlusion time is not that one long big burst of it. The long big burst is going to be harder to tolerate. You probably will get a little bit more benefit if you're occluded for that longer period of time. That doesn't mean you should go for a half hour or 45 minutes or anything like that. I usually keep it between 15 to 20, somewhere in that range. But in terms of the sets and reps, the goal of blood flow restriction is to, number one, fatigue the tissue, right? So if you do an exercise and you're not adequately fatiguing the tissue, you're not getting the maximum benefit of it. Again, the goal of blood flow restriction is to fatigue the tissue with 20 to 30% of that one rep max, give or take. And if you do an exercise and the patient or the runner or the athlete doesn't feel like it was much of a challenge, either A, check the pressure that you're occluding at, make sure, I wouldn't go higher than 80% occlusion, but make sure the occlusion is adequate. Then you can change the resistance, obviously. Or you can change your rep scheme. So all too often people go to the generic rep scheme that most people kind of go with, is the 30, 15, 15, 15 rep scheme, right? And that's 30 reps for the first set. Then you have a 30-second break. Then you have 3 more sets after that of 15. Each set of 15 is followed by a 30-second rest break. So it's 30 reps, 30-second break, 15 reps, 30-second break, 15 reps, 30-second break, 15 reps, okay? And then you can either call it a day there, or maybe go to another exercise, or bring the pressure down and then give them a little bit of break and then bring the pressure up. It all depends, right? So that's one way in which you can do it. I tend to do a lot of work, and I think runners in general will really benefit from this. I tend to do a lot of work with the foot and ankle and the lower leg. And those muscles, especially in the foot and ankle, are really hard to get to that with regular strength training, to get to that 70% of your one rep max. It's not like you can grab a dumbbell with your toes and say, this is 70% of my one rep max. Your foot muscles are small, intrinsic muscles that need to be, stability oriented, but also need to also have some endurance components to them as well. And, a lot of our traditional strength activities don't really hit where we need to hit them, I think. So for me, I tend to really put the blood flow restriction on with my athletes as well as with my injured folks because I think I'm going to get a lot more bang for my buck doing it. And I do blood flow restriction doing balance exercises. So how do you do balance exercises with the 30, 15, 15, 15 rep scheme? You really can't. So maybe you go by time, or maybe you do, you can do reps with balance if you're doing a certain type of exercise with it. So sometimes I'll have people stand on my, what we call it, it's like a blackboard, or it's like almost like a foot-sized wobble board kind of thing. And I'll have them do several sets of 30 repetitions on that with a 30-second break. Or I'll have them balance on an AirX pad twisting a TheraBand tube, and maybe I'll do a couple of sets of 20 with that. There's a lot of different ways to skin the cat, but the goal at the end of the day is to fatigue that tissue. I'll do TheraBand exercises with blood flow restriction to the ankle and to the all four planes, inversion, eversion, plantar flexion, dorsiflexion. And traditionally, I tend to do that with TheraBand without the blood flow restriction in the neighborhood of 60 repetitions. With the blood flow, I'll continue doing it with 60 repetitions if they can tolerate it. If they can't, maybe I'll drop it down to 30 and maybe do 4 sets of 30 or 3 sets of 60. Whatever it may be, the goal at the end of the day is that last set needs to be tough. It needs to be so that they're really kind of grinding out that last couple. Blood flow restriction is not a comfortable modality, we'll call it. A lot of my athletes hate it initially, and then they get used to it. Their leg starts to swell. Sometimes it turns red. It's a real uncomfortable, awkward type of feeling. It's amazing when you get a big, strong football player in there with a 2-pound cuff weight doing leg extensions off the edge of a table. And in the traditional 30, 15, 15, 15 rep scheme, by that last set, they're dying. They can't lift that 2-pound cuff weight. And these are, 270-pound linebackers or whatever it may be, right? So it's a really humbling type of activity. It's not meant to be easy. It's not a walk in the park. And if it is, you're doing it wrong. But at the end of the day, it's a quick and dirty way to really stimulate that tissue and prevent it. If we shift gears and go to the injured population, I love it. One of my favorite type of injuries to rehab is an Achilles tendon tear. And we know that Achilles loading early on is really something you want to stay away from, or plantar flexion, that pointing of the toe, is really something you got to stay away from. But when we're starting to early initiate it, I'll throw that blood flow restriction cuff on them, and I'll have them just do some ankle pumps or some pointing of their toe up and down, just to kind of stimulate the calf and get that benefit as much as I possibly can. I'm going to get more benefit doing that with the blood flow restriction than I would if I wasn't using it. There are even some studies out there actually to show that if you throw the blood pressure cuff on the uninjured side and do exercises on that side, there is a systemic effect, meaning that your body and those hormones that are released throughout the body will gain some benefit to that injured side as well. So there is use for doing it there, and there's also use for people doing it during aerobic activities like stationary biking. One of the blood flow restriction devices I really like is something called Suji. And it's waterproof, so people can actually swim with it, which is really, really cool too. I know this is a running topic, but that's a cool device also that people can actually get wet, take in the water with them, and gain some benefit from their aerobic capacity side of things in the pool. So just make sure they can swim, and just make sure that's not too deep so they drown on us if they get too tired. But those are just little precautionary things. But I think it's a wonderful tool for people to use.
Yeah, I was going to say a couple of things that you brought up that I wanted to mention before we move on, because the first thing, right, is that for anyone who has never used blood flow restriction cuffs before, I know you mentioned the whole point is to be fatigued, and as long as you're getting to that point of fatigue, you're going to see some sort of benefit. It is very easy to get fatigued on that thing. It sucks. Like you said, all my patients hate it, but love it too, because they can see the benefit in it as well. Like I was talking to my one patient who had an ACL reconstruction. We've been using it on her, and she's, I want to say, I think it's gonna be 7 or 8 weeks out. I'm forgetting right now, but her quad looks great. And that's another thing too, like talking about, let's say, ACL reconstruction. You could be a runner with an ACL tear, whatever situation. If you're not using something for a long time, that muscle will atrophy. So it basically will just get smaller, and you'll notice a big difference between your right and left, whatever side is injured. And a lot of times it's hard to build back that atrophy. But blood flow restriction is really good for trying to limit as much of that atrophy as possible after something like an ACL reconstruction. So I like that you mentioned fatigued. And for anyone out there who's never used it before, it sucks. It's actually very easy to get fatigued. So that's one thing. Another thing that you mentioned was if you're not going to fatigue, you're doing it wrong. You also mentioned you probably shouldn't do it for 30 minutes straight. A couple other things you mentioned about not doing it right, which I do want to bring up that part because I think people are talking about it more, but I also think that there is a lot of blood flow restriction cuffs out there for really, really cheap that don't actually work or like occlude. And so I think there's definitely people out there who are not using it correctly. And I wanted to mention that, like, what are things that you know or seen that people are doing wrong if they're
So
using
number
them?
one, I'll say blood flow restriction has been around a long time, and it's been very, very popular in the bodybuilding world. If you look at it, I've gone to the gym several times and I've seen people with straps. Not the non-medical or scientific. We'll put that brand on it. Type of cuff that we traditionally see in rehab these days, but like literally a strap that they strap around their upper arm because that's where they should be worn. They should be worn either around your upper arm or your upper lower leg, up like in your upper thigh area. Those are the two spots they should be worn. So I will say that people sometimes put them in the wrong spots. They put them below the knee. It shouldn't be below the knee. It should be up in the upper thigh. It should be up in the upper arm, just kind of by the axilla region, as high up as you can get it. So it's been around a long time. The problem with just straps is that you have no idea how much blood is getting in or out, right? So I'm going to say it's a lot less safe doing it that way, right? Blood flow restriction is safe if done correctly. Okay, there are some situations in which you wouldn't want to use it. Somebody that has clotting potential or has a clotting problem or DVT, a deep vein thrombosis, history of rhabdomyolysis. I'm going to say that wrong. I'll just call it rhabdo.
It's a hard word to say.
But so those are people in which you really shouldn't use it. And we'll just put the disclaimer here. Before you do any type of blood flow restriction on your own, make sure that you're under either the guidance of a medical professional or get clearance from your physician, okay? Because it isn't something that you should be kind of messing around with haphazardly, okay? But I do believe it should become more mainstream with technology and with certain types of devices that are out there. I think it will become more mainstream in the future because I think there are so many benefits. I really do believe this. In my heart of hearts, I believe that the aging adult, the aging athlete would benefit so much from utilizing this because, again, the wear and tear on the joints is so much less. The wear and tear on the spine could be so much less if you're using some of these type of tools to aid in some of that. Now, again, I don't want it to replace normal strength training. It shouldn't, but it's a tool to utilize when you feel you need it.
I like that too because I was literally before you hopped on here having a conversation with a run coach who is a friend of mine who's actually on this podcast earlier episodes too, and she told me she has a client right now who is, I guess, technically in the geriatric population. I don't know how old she is. She has an older client, and she said that her PT told her that she shouldn't be lifting weights, which blew my mind that was even something that was said. But I want to bring up the fact that like blood flow restriction training with the aging population might be a good way to convince people who maybe already have some sort of belief that they really like value and like stick to, that it's scary and that they shouldn't be lifting weights. Like, I think it's a good way to introduce it and also stimulate and try and strengthen the muscles while trying to meet halfway with that type of person who hopefully doesn't have like a healthcare professional stopping them from lifting or strength training. But if they do, and they're one of those people who is just going to like wholeheartedly believe them, not go for a second opinion or anything, that might be a good way of introducing that to that type of
Think of it this way
population.
too. Another thing that is really helpful is not all runners have memberships to gym, right? And there are a lot of units out there now that are, there's the expensive one and the gold standard one, which is like the Delphi unit, right? Which is several thousands of dollars to get into your clinic and such. And at Florida, we have several of them. Any way you look, we've got them, right? But in terms of like the let's call it the home gym or the home exerciser who's got 5-pound dumbbells and some ankle weights, how can they benefit? Because we know that if they do that, if they're using 5-pound ankle weights or 4-pound ankle weights and 5-pound dumbbells, they're not really strength training, right? They're not. The BFR could be a great tool to incorporate and allow them to work out at home with those same type of situations. And get some benefit out of it. Now we know, just like anything else, in order to gain benefit, you're going to have to progressively load. So maybe over time that 5 pounds turns into 6 pounds or 7 pounds, right? You got to continue to challenge. And like I said, either go up with weight, go up with reps, increase the pressure, whatever it may be. There are ways in which you make the activity more more intensified or more intense. But it could be a cool or a new way of thinking at the workouts from home. The cool thing is you can go to the park, right? You can put on the BFR bands, whether it be the Suji ones, the smart cuffs, whatever it may be strong. There's a bunch of them out there, each with their own positives and negatives. But you can incorporate this into a gym workout at the park. You can incorporate it into a gym workout from your home. Traditional body weight squats are made more strength training esque if you were to kind of incorporate some blood flow restriction with them. So that's just something to think about also going forward, where people don't have to have a gym membership. Now, some of these devices do cost, a couple $100. So, but again, what you get in the cost there, you get from your time and convenience from being able to work out at home. And again, you could also work out at the gym using them too. There's no problem. I've seen people at the gym wearing blood flow restriction cuffs all the time, and I think it's becoming more and more popular.
I also like, those are all great points. And I also wanted to mention that I know you mentioned the systemic response before too. And the systemic response, for example, like the person I had who was post stress fracture and we were using it, right? That is one way to use them, but I like the whole aspect of using them before, like while they're actively in that stress fracture, like healing from that stress fracture, of like you could also use it on the other leg. That is another thing that I wanted to mention, because injury wise, a lot of times, I don't know if you've had this situation where you've had a patient that maybe had a stress fracture or something else where they were told to wait to go to PT until that fracture healed. So, for example, that person waited 8 weeks, I think, to come and see me. And I was saying like, oh, this would be a great opportunity to use the blood flow restriction cuffs. But I think that there's a lot of people who do that. So I think it's worth mentioning that even if you're going through something that seems like you wouldn't be able to do much at PT, like that is a perfect situation where you 100% can.
So a good example of that is I talked about the Achilles repair, but we have athletes that have Achilles repair that sometimes get put into a splint of some kind for a couple of weeks, then they get casted for a couple more weeks, and during that time, if you're telling me we can't do anything, that's a lot of wasted time. And not only is their surgical site falling to crap, but the rest of their body is too, right? So it's a great way to incorporate some type of strengthening and get some benefit too to that tissue that's not even moving. So for this case, an Achilles repair, sometimes we'll put the blood flow restriction on and we'll do leg extensions. We'll do leg lifts, whether it be flexion. We'll work hip abduction. We'll work on hip extension. There's a whole host of things you can do that allow that tissue that needs to rest, but not allow everything else to fall apart. So obviously with an Achilles repair, somebody that's non-weight bearing, how else are you going to strengthen, the quad? How else are you going to strengthen the hip? You can't weight bear. It's not like so you're very, very limited as to what you can do. With the blood flow restriction, you can actually put, again, a 2-pound weight on the leg, do some leg lifts, and get a whole lot of benefit of it, and not let that 4-month period allow your body to fall to crap.
Which I think is huge, because that was, for I feel like a very long time, what people would do, just wait. Even with the whole ACL reconstruction thing, like after an ACL tear, it was just like known that your quad was going to get really, really small compared to the other one, when now people are using it and there's so many great benefits. It looks so different than what it used to be. Like, I literally remember when I was in high school and middle school, and I had people I knew who had tore their ACLs, and like their quad was like nothing. And again, like just even comparing to like who I have right now, like as a patient who I'm using it with, I'm like, I can't believe that you're at where you're at and how good your quad looks. So it definitely works. And another thing I wanted to mention that you brought up before was like, you can use it for strength. You can do like a couple pounds, 5 pounds, whatever, and you can get that strength benefit, just even by doing little weight. You also mentioned balance. You also mentioned being able to do it in the pool or aerobically. But one thing I really wanted to talk a little bit more is aerobically, right? Because I think most people do know BFR as this thing you do with weights. Even if it's not that much weight, it stimulates it as if you're lifting heavy. But you could use it aerobically. So tell me, like, could a runner use it running? Like, have you had a situation where you've done that for someone? Because I think that's the part that's a little less talked about. And I think also the part that someone like a runner would be interested in, if there's benefits to that.
So a couple of
at
things.
all.
Before we go on to that, I want to just circle back real quick, and this needs to be said. I wouldn't put the blood flow restriction on a limb that's freshly had surgery and isn't really kind of closed and healed. And I'd be careful about putting the blood flow restriction on an area that's casted, because again, there will cause some swelling, and you want to make sure that you're not getting any type of significant restriction in that area based on the swelling and the influx of fluid into that area that's not kind of being disseminated throughout the rest of the body in a given period of time. So just keep that in mind. Early on, you might want to do it on the contralateral limb. Make sure the wound is closed. Make sure you can kind of identify and visualize the skin and make sure everything's looking good before you start doing this. But that's just that. In terms of the running with the BFR, you can do it. I wouldn't go for miles upon miles and miles of running. You can definitely run with it. I think doing it around a track would probably make the most sense, so that you can toss them to the side and not worry about somebody taking them or stealing them, because you don't want to, go for a 15-mile run and have these things on the entire time. That's just not realistic, right? We tend to use it more with our rehabbing athletes on the bicycle, to be honest with you, to make sure that their fitness doesn't fall apart when they can't kind of do a whole lot. So we kind of pump up the volume, so to speak, with their aerobic training on the bicycle. That works pretty well. I haven't used it in something like the Boost or the Alter G or anything along those lines. That has other benefits that I would say would be similar to that of the BFR, in that you can de-weight the body and not put the same amount of stress on it, but still get some benefit. Same thing with BFR. You de-stress the body, but get a similar amount of benefit. But I have had people run, but not too much. We tend to do it more in a controlled environment, like a stationary bike, etc.
That's what I typically see and know as well. I wasn't curious if like there was maybe a reason why someone would use it running, because like you mentioned, even just we think about the intensity of how little of weight you can lift and how hard that is. First, if you were running, like that intensity is going to be higher.
That's why
so
I think
I wasn't sure how that would
swimming is
work
better
out.
because of the buoyancy of the water. You're not having to necessarily kind of stroke or struggle as hard, especially if you're in a pool, as opposed to like open water stuff. I wouldn't do it open water. I would do it in a pool, controlled environment, that kind of stuff. And I think there is some benefit there as well. Go for a nice easy swim and kind of put the cuffs on and get a little bit of work in extra that way. Again, great for somebody rehabbing that you don't want to put the stress on their lower body. You can still get some cardiovascular benefit as long as they're a decent swimmer. Same with the bicycle.
How long would you do it for? It's the same thing, about 15 to
Yep.
20 minutes.
And there are different ways in which sometimes people sometimes will go, let's say 5 minutes of cycling, take a minute off, with the pressure on the entire time. But that doesn't necessarily mean you have to cycle continuously the whole time. So you can go 5 minutes of cycling, take a minute off, 5 minutes of cycling, or 3 minutes of cycling, or even 1 minute of cycling, minute on, minute off, minute on, minute off. That works fine too. Those are just seeing how the athlete tolerates it and how much resistance are you putting on the bike, if any. So all of those factors need to come into play. The goal of the activity is to make the athlete feel like they're working a little bit.
Yeah, so I was going to say, intensity-wise, I think it's a little bit more confusing in terms of like what intensity to use. So for a bike, would you do the increase the resistance, or would you like make them
You can do
go
both. You can change it up
faster
and do
when they
both.
do it?
Maybe one session do
Okay.
more of a high resistant, almost like a sprint kind of workout on it. And again, you don't have to go crazy high resistance again because you have the blood flow on. It's going to make it that much tougher. But you can make it a little bit tougher to pedal. Maybe go 30 seconds on, 2 minutes off, 30 seconds on, 2 minutes off. You can get some benefit that way. Or you could, but again, the more resistance you have, the more strengthening, quote unquote, you're getting out of it. Whereas if you're just kind of doing more of a light pedaling and you're just using those muscles at a lower intensity for a longer period of time, you're getting some other benefits in a different way. But those chemicals that are being stimulated regardless, right?
Right. No, that makes sense. And so for the people out there who are kind of interested in maybe getting blood flow restriction and utilizing it, and maybe are just on that aspect of sports performance, how many times per week would you recommend the healthy individual, quote unquote, no injuries really going on, but wants to use it when they're in season, like we talked about? Like, how many times per week would you recommend that person to use blood flow restriction training versus maybe just strength train?
For me, I think that's going to vary a little bit. But I think if you can get on it once a week, I think would be great. I tend to not do blood flow restriction more than 3 to 4 times a week. I think is plenty. On even an injured person, depending on what you're doing. So you can always change it up, work a different tissue, work the upper body, work the lower body. Even with the runner, the upper body is important too. So you can kind of use the upper body one day, lower body one day. It just depends on how you're feeling. But I'd say if you wanted to incorporate it once a week, I think that's plenty. I think that's a good start.
And that's the same for like once a week for, let's say, an injured individual. Like, I've had people who literally have asked me, injured runners, who were like, even if I'm coming here once a week, would it really make a difference?
Absolutely.
I've had a couple people ask me that. So
I would say,
what would you say
if you're
about that?
injured, once a week is fine, but twice a week or 3 times a week is even that much better. To kind of get that stimulus, every other day is a good kind of way to kind of go with it. And then depends on how you use it too. So you can use it as a recovery modality, like we talked about. So where you're not really necessarily holding the restriction for any length of time, but more like a Normatec boot that creates that pumping type of mechanism. A lot of the devices, I'm going to speak to Suji because I'm familiar with that one. I know that they can definitely create that pumping type of mechanism, and that's one of the things that they kind of really like to push with their product. And they have it built into their app where they can actually customize the on and off cycles, very much like a boot would do. So just different things that are out there. I'm sure you can do that with some of the other ones too. I'm just not as familiar with them.
So what is it called again?
Suji.
How do you spell that? Okay, Suji. You said it's like a preset. Preset.
Yep.
Yeah, to do that. Okay. And so let's see. I had something else to ask you and now I forgot. But so recovery, that's good. Is there anything else that you feel that we didn't mention in terms of blood flow restriction training that would be important to mention?
We talked about some of the precautions. So again, there is a little bit of something to think about before you put them on. I think the take home message is it's a great tool. It can be used for not only the injured but also the well, for also the aging. It can be used not only for strength training but also aerobic capacity building. It functions by stimulating similar chemical responses and hormones that are stimulated with heavy resistance training. And I think there's a lot of benefit to it. I really do. I think during season is a great time to allow our athletes to continue to try to maintain some strength. You know, in season isn't necessarily always the time to build strength, right? In season sometimes is a time to maintain. And a good way to maintain strength is to load. But if you're constantly beating your tissue up with other activities and competitions and practices and everything else, sometimes your tissue might need a little bit of a break. And this is one way in which you can do that. And I think it's a way that can, and in my opinion, should be utilized a little bit more frequently than it is.
I think you saying that, this was the question I wanted to ask you, was the fact that we're talking about it. Let's say someone has never put these cuffs on and they really know the basic minimum. And we're talking about how easy it is to get fatigued using these. But we're also talking about using it for recovery and how it would actually help for recovery. How, for people out there, I think they would think, based off of how hard it is, because it is hard when you have it on, that you would be really sore the next day. But I've had a lot of people tell me, nope, they're not.
You're not really creating the same type of damage to the tissue that heavy resistance training does. That's the beauty of it. So the soreness isn't nearly as much as it would be if you were doing heavy resistance training, because it's the breakdown of the muscle tissue that really kind of allows the body to build back up stronger. Via those chemicals that are released oftentimes, right? The human growth hormone, the insulin, growth factor 1, a lot of the other things that are out there. You know, we don't have to get too sciencey here, but there's a lot of stuff that kind of happens. And in order to get sore, you've really got to stress that tissue. And we know that, you know, eccentric loading creates more soreness than concentric loading a lot of times. Why? Because you can handle a lot more weight eccentrically than you can concentrically. So if we look at eccentrically versus concentrically versus BFR, you know, the amount of resistance you're using or able to tolerate in each of those is going to be less. Therefore, the soreness associated with it oftentimes is going to be less as well. So that's kind of how I kind of wrap my brain around it, and it makes sense to me, and I'm hoping it makes sense to those listening right now.
Yeah, no, I think you explained it really well, especially for people who have no idea what it is, or maybe the bare minimum. And I wanted to mention the whole sore thing because maybe someone is listening out there and they're like, I'm going to get these things, and they're all hyped and it's really hard. They do it all right, and then they're so confused the next day why it was like 10 times harder than even lifting and why they weren't sore. So I wanted to mention that because a lot of times people ask me.
It's also a great tool to use for, you know, if you're working trying to, you know, increase your recruitment. Because it is so challenging, your body is trying to use every single muscle fiber it can to make that motion happen. So people sometimes talk about doing it at the end of their therapy sessions or the end of their workouts, because, you know, you're really working on fatigue, and I think there's benefit then. But I also like to do it early on in my therapy session because I think it increases recruitment that then can carry over to some of the other exercises I'm doing. So you can play with the timing of when you incorporate it into your therapy sessions as well from a rehab perspective. So I think that's a neat thing. I like to do it a lot of times, like I said, with balance exercises. I do a lot with hallux extension and hallux flexion. You know, again, how are you going to do that with TheraBand, right? So that's wonderful, but if I can put my TheraBand on steroids, so to speak, by using the BFR, I think you're going to get a lot of benefit from that.
Yeah, like how you mentioned that, because I know at the Run DNA course, we were talking about me and my injury of like my foot. And you were saying that a lot of times you have used blood flow restriction training on a similar situation like mine, and it's done wonders for people. I still have not done it yet. but I plan on doing it this week. It's been kind of crazy at work, so I haven't had the time, but I'm definitely going to be doing that and utilizing blood flow
Even an
restriction
exercise
training
like
for
the
me
short
as
foot,
well.
which is basically creating that dome foot, again, you're not using any resistance with it. You're teaching your body how to do it. And if you can do that under a little bit of load or quote unquote fake load via the BFR, I think you're missing an opportunity is what I think.
Right. So I think it is definitely the new way of rehab and even sports performance. So I think that the things that you explained were a perfect way for someone to feel a little bit more comfortable and know how to use it correctly, because we also don't want people going out there and just using cuffs that don't work, or doing it the wrong way, or doing it in a way that's not safe. So yeah, I agree. Like you said, always consult, whether it be your physician, healthcare provider, whatever, but just understand that these are kind of the parameters to do it. I always ask, kind of moving away from blood flow restriction training, or you could utilize a blood flow restriction training answer. But my last question I always like to ask people is one piece of advice you wish someone gave you when you first started running. And so I know you said that, you don't necessarily love it all the time, based off your history, but it could be something like, blood flow restriction training is helpful for runners and whatever. I wish more runners would do this. I think it's always nice to have a different perspective from everyone. So what is one piece of advice you
So
wish
for
someone gave
me,
you?
I think the missing piece to a lot of runners and a lot of reasons why runners end up in our clinics is, and it goes along with blood flow restriction, but we'll just say general strengthening for the runner is often something that lacks in their programs. Most runners struggle to find the time to run, let alone to add strengthening into it. And I think so many more runners would benefit from a performance standpoint and an injury prevention standpoint, allow them to run longer, safer, and healthier with probably better times if they incorporated strength training more and less of their running volume. So I think that trade-off of less volume, more strengthening will pay dividends in the long run, as opposed to having to hit the pavement 6-7 days trying to be volume. The other thing I'll say is this, is that I think runners need to go out for runs with purposes. Like, what is your goal of this particular run? Is this run to increase speed? Is this run to just be a shakeout run? Is this run designed to increase my lactate threshold? Most runners run their slow-paced runs too fast, and they run their fast runs too slow. So they're not maximizing the time on the road, and they're kind of somewhere in no man's land. So I think have a purpose for what your runs are designed to do, and do that, if that makes sense.
Yeah, I completely agree. People do that all the time. And I think that is a huge part, because I talk about it all the time with some of the clients I have, where I look and I'm like, you're running way too fast. And a lot of times people don't know what that gray zone is, which is basically what you just mentioned. And having that purpose, I think, really, really does lead you into the right position of where you should be at that time in that season. Also understanding where you are in the season, right? Like, are you supposed to be building strength? Are you in your off season going a little lower with your volume or working on base mileage? Or are you like in prime in season competitive phase? I also like that you mentioned the part with strength, where you say that you can decrease some of that run volume and bump up that strength and probably see more benefits doing it that way. Because I know a lot of people who are running crazy volume and do not strength train at all. And I think the same way in terms of like, I run compared to other runners or long distance runners a pretty low volume. And it's because I strength train like 3 to 4 times per week as well. And I personally believe that you can get as much out of as possible out of your running volume, even if it's small, and you shouldn't bump up the running volume or the weekly volume until you know you've really gotten as much out of the amount that you're giving yourself for that week, if that makes sense. So I like that you mentioned that, because a lot of people do run like crazy mileage and don't strength train at all for that
And then
exact
again,
reason.
just doing crazy mileage at a pace that is, too fast to get the aerobic capacity benefits, but too slow to get the lactate. You're kind of, like I said, you're wasting good opportunities to kind of actually get better. And yeah, so it's different. Everybody's not the same. Some people respond better to more mileage than others. So, that's I think for me, the hardest job out in high school coaching is the high school cross country coach. I think I might have mentioned this in the course, because you've got a large team oftentimes of male and females that are of varying levels of maturity and maturization, and various levels of skill, and a coach that oftentimes doesn't have the time or the means to make individualized training programs for all those kids. So you come up with a one or two size fits all approach, and unfortunately that's not necessarily the best way to do it, because everyone is not going to respond to the same type of training methodology, let's say. So it's a hard job to have. So being very individualized in your approach and knowing what works for you is something that I think every runner needs to come up with. And I do think that regardless of whether you're a low volume or a high volume runner, strength training needs to be part of your program, not just for performance, but for prevention. The more capacity your body has, the more capacity your body is able to deal with, the less likely you are to push beyond your capacity. The greater the capacity, the harder it is to push beyond the capacity, is the easiest way to say that.
Yeah, no, that's so true. I mean, like everyone who I coach, I say like I will not coach you unless you completely agree to strength training. It's just something that I believe in my core, that I feel like I'm not going to be able to help someone to the best of their ability if they're not willing to do this one thing that we know is so important. So that strength training component is huge, and that individualized component is also huge. Making sure that whether it be yourself or whether it be you finding a coach, that you just ask the questions, whether that be internally or to that person, of like, how are you making this individualized to me? And thinking about it in a way of like knowing that whatever you're doing is where you're meeting where you're at the time, and what's best for you, not what other people are doing. Running could be a sport where people get like their ego will get the best of them. So, they see someone else doing something and they want to do X amount of miles too. So I think those are actually really, really good tips and good advice. So Scott, thank you so much for being on here today. I really appreciate it. This was such a great conversation with blood flow restriction. And I'm so glad, because it is being talked about more, and I want more runners to use it too, and be able to find it, whether they buy it or go somewhere that does have it. So thank you again so much. If there's any way that people want to get a hold of you, do you have anything like an Instagram account or any social media or email that people can get a hold of you? I will put everything in the show notes, but I figure I just meant
Sure. So I have a website which
I
I have some stuff on. It's runsaferunfast.com. Any courses I'm going to be teaching will be linked there. I'm actually teaching a BFR course, so that'll be on there as well. And then you can go to scottgreenberg.dpt on Instagram. That's my Instagram handle. I'm happy to chat with you there if you have any questions.
Awesome. Okay, everyone. So Scott Greenberg, thank you so much again.